Ladies and gentlemen, welcome to another episode of MedSynapse podcast series, your trusted source for medical insights. I'm your host, Dr. Nigar, and I'm thrilled to guide you through today's captivating conversation. Today, we have the privilege of hosting a luminary in the field, Dr. Yasser Bhat, a certified consultant pediatric cardiologist from the Saudi Council for Health Practitioners. Dr. Yasser, with over a decade of experience and expertise in various facets of pediatric cardiology, including transthoracic and transesophageal echocardiography, fetal echocardiography, and interventional procedures for congenital heart disease, is here to discuss his recent research paper on the crucial need for cardiac services in a neonatal intensive care unit. Welcome, Dr. Yasser.
Thank you. Thank you for having me.
Dr. Yasser, your expertise in neonatal care is truly remarkable. Could you please share with our audience the title of your recent research paper and the driving force behind delving into this area?
The title of our research is The Burden of the Neonatal Referrals on a Pediatric Cardiology Service, a Local Center Experience. So, as we know that congenital heart disease is a common occurrence in live births, and 25% of them exhibit critical congenital heart disease. So, therefore, cardiology service should be available round the clock to ensure timely diagnosis and management. The rationale of the study, the aim of the study was to describe the workload and the need for pediatric cardiac services in a maternity hospital for newborn referrals. Moreover, the study describes the indications for the neonatal cardiology consultations.
Fascinating. Now let's paint a picture of this study. Could you please describe the setting and design that framed your exploration into the need for cardiac services in neonatal intensive care unit?
Yeah, this was a prospective observational study which was conducted over a period of 4 months from January to April 2022. And in Prince Sultan Cardiac Center and Al Qasim region of Saudi Arabia. Yeah, so our cardiac center provides cardiac services to the maternity and children hospital here in Buraida Al Qasim. Out of the total 2,606 live births during the study period, the cardiology team evaluated 352 neonates. Neonates less than 30 days of age who were born in the maternity hospital were enrolled in the study. The outborn babies referred from other centers as suspected congenital heart diseases for whom a cardiac evaluation was done were excluded. Moreover, babies assessed in the emergency room and born elsewhere were also excluded, and only new consultations were considered as a referral, excluding the repeat consultations. Furthermore, the babies are seen in the outpatient department during this time, or the children referred for cardiac evaluation from other subspecialties, pediatric subspecialties. They were also excluded from the study. So only the particular group chosen for the study was the neonates less than 30 years of age, which were born inside the hospital.
Now, delving into the heart of the matter, Dr. Yasser, could you please share with us the number of neonatal cardiac referrals you encounter and shed light on the primary indications that led to the need for cardiac evaluation?
Yeah, as I earlier told you, we had out of the 2,606 live births over a period of 4 months, 352 neonates were referred for cardiac evaluation. So, accounting to 13.5% of neonates referrals. So the common indications were the cardiac murmur, which was the common indication among the referrals, accounting for the 80% of the referrals, the commonest indication. The other indications were the desaturation, congenital anomalies, syndromic features, failure to wean from the mechanical ventilation, family history of the neonatal deaths, or family history of the congenital heart disease. Also, we had significant referrals from the follow-up evaluations of fetal diagnosis. So the patients who had fetal evaluation at our center, um, out of them, almost 13.9% were referred for the postnatal cardiac evaluation. Also, the babies born via uh, in vitro fertilization were also referred, and the patients who had a weak femoral pulses in the NICU or who had a sepsis, they were also referred for cardiac assessment.
That's a very impressive scope of study. Now, let's talk about the findings. What were the prevailing cardiac lesions you diagnosed? And perhaps more crucially, how many of these cases presented with critical lesions?
Yeah, so we have the commonest diagnosis were in the isolated atrial septal defect, patent ductus arteriosus, so which form the majority of the lesions, and the other lesions included this patent ductus arteriosus was the commonest lesion associated with the other congenital heart diseases. So, out of these, we had total of 295 lesions, and 4.4% of them were critical lesions. And among the critical lesions, we had tricuspid atresia, we have hypoplastic left heart syndrome, coarctation of aorta, hypertrophic corrected transposition, detransposition of great arteries. So these were some of the critical lesions we encountered during our research.
Thank you so much for the valuable insights, Dr. Yasser. Now, as we conclude our conversation, can you share with us the conclusion drawn from your study? And what are the key takeaways for the medical community and beyond?
Yeah, actually, this is an observational study, and we cannot infer too much from this study. This is not an experimental study. Okay. However, having said this, it will give an idea about how much is the burden of the neonatal referrals on cardiology service. So that might help the healthcare authorities to allocate resources and optimize the delivery of cardiac services among the neonatal population. So, moreover, properly allocating pediatric cardiologists to the needed centers may optimize neonatal cardiac services. So, there were some limitations also in our study, like we only consider the patients for evaluation. Only the new referrals were considered for evaluation. So the repeat referral consultations in NICU is very common, and we have to exclude them. So in that way, our study is underestimating the true burden of the neonatal cardiac referrals.
Thank you so much, Dr. Yasser, for enlightening us with your research in the world of neonatal cardiac care. I'm sure this was a thought-provoking session for all our audience. Thank you so much for tuning us. Looking forward to many more podcasts together.
Thank you. Thank you so much.
And to our incredible audience, stay tuned for more captivating episodes on MedSynapse. Don't forget to subscribe on our YouTube channel and register on our platform for exclusive updates. Until next time, goodbye.